Placenta previa is a condition where when a portion of the placenta covers the cervical os. Normally there are two osses, internal cervical os and external cervical os, and placenta is the organ which supply nourishment to the baby, and during the delivery it play a vital part because placenta remain inside and it comes out at the time of the delivery at the end of the baby expulsion. So that's why if the placenta is anterior to the baby, so it causes problem with the delivery and delivery will no longer be maintained. There are certain grading for the placenta. Before going to talk about the placenta grading, it is better to have a look to the anatomical status of the cervix, where the internal os starts, where the endocervical canal begins, and where the external os ending. So let's start looking for the anatomy of the cervical region. Have a look to this image. This is the image of the uterus and uterine cavity. Normally uterus happens to be 7 centimeter long and it contains three parts: the fundal region, the body and the cervical region. So far the placenta previa is concerned, we are looking for the cervical region where it has two openings. One is internal os, that small opening directly communicating with the uterine cavity. This is the place where we will confirm the placenta previa and different grading of the placenta previa. Down there is another opening which is called as external os. External os is directly communicating with the vaginal wall. In between the internal os and external os, this area is called as endocervical canal, which is also having its own very important. So therefore sometime in incompatibility of the cervical area, we usually measure the length of the cervix. At that point it is very important. So for the placenta previa grading is concerned, we usually look for the internal os opening. So that is the point where we concentrate on the level of the placenta. So let's start looking for the placenta grading. Placenta previa has been given 4 grades. So let's start looking for the grade 1, 2, 3 and 4. Placenta previa grade 1. This is also called as low-lying placenta previa. So the criteria for the low-lying placenta previa is it ranges from 0.5 millimeter up to 2 centimeter away from the internal os. So this is what the distance of the placenta is. If the placenta is away from the internal os up to 2 centimeter, this would be still considered as a low-lying placenta. However, in early gestation it is likely to occur, and that's why a follow-up scan should be offered to look for the status of the low-lying placenta, whether it is slipping down to causing grade 2 or 3 or it is going upward. It usually happens with the age of the pregnancy, and usually in majority of the cases we have observed that this low-lying placenta previa goes upward and the chances of the placenta previa remains narrow. So therefore must pay attention to the grade 1 or low-lying placenta previa, always mention on the report, and follow up for the placenta position. Another grade of the placenta is called as grade 2 placenta previa. It is also called as marginal placenta previa because the presence of the placenta on the edge of the internal os would be considered as a marginal because it is not obscuring the opening of the internal os. So that's why it is marginal placenta previa. In marginal placenta previa, again a follow-up scan should be advised to look for whether again this marginal placenta is slipping down to cover the opening of the internal os or not. And the second thing is also you should observe whether this is going upward in with the pregnancy or the gestational age. Mind you that placenta low lying grade 1 and marginal grade 2, these both placenta cannot interfere with the delivery process, and the vaginal delivery is still possible because it is not obscuring the internal os at all. Although there will be greater chances of covering the internal os in later age, but at the time of the delivery it is low lying, or if it is still marginal placenta previa, so it is not interfering with the delivery process. Next comes grade 3 placenta previa. This is also called as partial previa because it is partially covering the internal os. Partially meaning it is not completely covering the internal os. However, on this image you cannot easily appreciate because on the image it seems like it is covering the internal os, but as per definition, if it is partially covering and some of the portion of the internal os is still open, that would be considered as a partial placenta previa, or so far the grading is concerned you can grade it as grade 3. So grade 3 placenta is usually required surgery because it interferes with the delivery process as well. So in the grade 3, again usually we need to follow the patients up for the status of the placenta previa. Sometimes it also covers the full internal os, and it may becomes placenta previa grade 4. But in placenta previa grade 3 and 4 there is surgery recommended, so one go for the cesarean section because it will interfere with the delivery process. And the last is placenta previa grade 4. This is complete placenta previa, and this usually occupy the entire internal os. It's completely occupying the internal os. So this is what symmetrical complete placenta previa. Sometimes it is symmetrical, sometimes it's asymmetrical, but it doesn't matter. It's just the classification, radiological classification. As far as management is concerned, for the grade 3 and for grade 4 the management are the same. You need to opt the surgery, you need to opt cesarean sections for the delivery, because in grade 2, grade 3 and grade 4 there is no longer possibility of the vaginal delivery and it interferes with the delivery process. So that's why the ultrasound examination is one of the important procedure where you can clinically, where you can pick the grading of the placentas accurately, provided that if the clinician has previously seen all these images and clinician pay attention to the placenta as well. Quite often we pay attention to the baby, we pay attention to the fetus and its internal structure, and we often forget the status of the placenta, but that is vital. So this was the 3 and 4 staging of the placenta previa. Now we are going to look for, there are certain associations and there are certain incidences in which there is a great risk of developing of the placenta previa. Risk and incidence of the placenta previa occurrence increases with maternal age. Whenever there is maternal age is increased, there is likely possibility of placenta previa. Not only placenta previa, but certain fetal abnormalities as well. Next comes parity. If there is history of multiparity or grand multigravida, so there will be a great chance of developing placenta previa. Multiparity mean like if there is more than 2, 3 or 4 deliveries in the past, so that will be considered as multiparity, and multiparities always remain a topic for the certain fetal and placental abnormalities. Next is the previous uterine surgery. If there would have any previous uterine surgery, so the surgical scar causes developmental abnormality of the placenta, and as a result you may see placenta previa with a different grading. So it depends upon the type of the surgery and it depends upon the seriousness of the uterine surgery, but whenever there is surgery there will be fibrotic scar, and these fibrotic scar attracts for the developing of the placenta previa. Like if there is previous certain caesarean sections, so these caesarean sections remain the area and place for the developing of the placenta previa. There are certain abnormal conditions associated with the developing of the placenta previa. The first one is maternal hemorrhage. If there is history of maternal hemorrhage, so that is the rather causes or associations of the placenta previa. If there is any abnormal presentation, so abnormal presentation is also a consideration for the placenta previa. IUGR, intrauterine growth retardation, is also associated with the abnormal placenta, particularly placenta previa. If there is a preterm delivery, so preterm delivery is also associated with placenta previa, it may cause placenta previa. Increased perinatal mortality, and this is the last one, which may cause or caused by placenta previa, increased perinatal mortality. So always keep these associations in view. Whenever there is placenta previa, you may come across with abnormal bleedings, with the abnormal presentation, with the intrauterine growth retardation. There may likely be possibility of preterm delivery, and the last, that there might be possibility of fetal demise, intrauterine fetal demise. So you must keep all these associations in view when you diagnose the patient as a placenta previa.